Good afternoon. Thanks for joining us. I'm Joanne Conroy, President and CEO of Dartmouth Health. This is our Connect with the CEO session, and we have certainly got a lot to talk to you all about. We've had an exciting week here with the announcement of our new visual and verbal identity for the health system, Dartmouth Health. It was really exhilarating to be in the room with hundreds of our employees announcing the brand. You know, the excitement and the enthusiasm was, palpable. We did say, was it because we were all together for the first time in 2.5 years? But that might have been part of it, but it wasn't all of it. It just felt like we were starting kind of a new chapter of our lives as an organization, and people were incredibly excited about it. So today's session, we're going to talk about the new chapter for the health system, and to clear up any confusion that might be circulating in your minds, because we sent out a lot of information in advance of the brand launch. And there are going to be some questions, but we've got two incredible guests who have been instrumental in this brand journey. Later on in my conversation, we're going to be talking to Brad Scott, who's the founding director of Applied via Zoom. Applied is an agency that specializes in all aspects of design, strategy, and implementation. They define the brand and create work that can improve a customer's experience, or in this case, a patient's experience. But first, joining me here in the studio is Jen Gilkie, Dartmouth Health System Vice President of Communications and Marketing. Hi, Jen. How are you?
Good.
We're working with different equipment here, so we have to wing it a little bit. So we've been on this brand journey for almost 3 years. Can you share, what that experience has actually been like, and what's involved in a brand journey? When we talk to people about the brand journey, I can't even imagine the visual that they have, but right. You could say it's like crawling across glass, or you could say it's like hiking the Camino, or you could say it's like hiking the Appalachian Trail with all of its highs and lows.
Right.
But what was it like?
It was all of those things. And I agree with you. It was really almost a bit emotional on Tuesday for me to hear the new brand being announced publicly. But this was a journey that we started almost 3 years ago. And we call it a journey because it's really a transition. And I like to emphasize that it's not a light switch that we're flipping, that it's a long journey. And it started 3 years ago. And the way that we broke it down, we looked at it as 4 different phases. So the first phase was an observe phase, where we really were in the community, talking to people, talking to employees, trying to better understand how we thought of ourselves, how we talked about ourselves, looking at other healthcare systems who are in the marketplace. And then we worked to articulate how we would think of differentiate ourselves, and what all of this work that we had learned through stakeholder interviews and focus groups said about who we were and who we wanted to be. Where were we looking to say to the outside world as well as the inside world? And it all came down to a phrase that we've used a lot. It's what we call our brand idea. And it's world-class care woven into the fabric of our community. And that was an important idea, and we used it to kind of cast off all of the other work that we would be doing going forward. So kind of a leaping point into what was the third phase of the journey, which was the create phase, where we worked to develop our logo and all of the various materials that hopefully people are now seeing, and to provide language for our employees to talk about who the system was, how it would unify us as one organization, and also help patients. And I say that a lot, that this is really an important journey and step for our patients, because we wanted to bring clarity for the patients to understand who all our various members were. We're a complex system, as you know, with so many different centers and members, and our logos all looked different. So we really, one of our goals here was to make it easy for patients to understand, no matter what organization or what doorway they walked through, that they could expect the same high class, high quality, world-class care, innovative, state-of-the-art, and also warm and personal. And that was an important differentiator for us too.
So a couple of observations to maybe comment on them. Number one, we are complex and it is confusing for patients.
Yep.
And even though, for example, we've worked very closely with Alice Peck Day on a lot of our emergency room care and our hospital medicine care, that's not immediately apparent in our previous structure,
Right.
and naming for patients. And you're right, it's going to make it a lot clearer to them about who's taking care of them. The brand journey was pretty iterative, though. I mean, you made it sound very polished, but there were times where you could just tell that the team was sensing the reaction and then sometimes redirecting course. And you could, now that we look back on it, you can really see how it evolved.
Right. Not to mention that typically a brand journey might not take 3 years, but we were also in the midst of the pandemic. So there were a number of times that we had to kind of pause our work and focus on COVID. And one of the things, though, that came out is it really helped to create a framework of collaboration working on the pandemic, which in the long run helped with the brand journey, because it really brought us closer together as a system, which was really a good thing as we launched our new brand.
Yeah, that's a good point. We came together much more seamlessly during COVID, which makes doing something as difficult as this a little bit easier. And we did get a lot of calls immediately the first day from a lot of other health systems that were really interested in what we had done and wanted to learn from our experience.
Yes.
So, well, good. Now, relevant to that, I think, was a lot of the kind of decisions, what to do with some names whose use in the organization was going to change. For example, Chad, Hitchcock, and the Norris Cotton Cancer Center have evolved and have different naming opportunities currently. So do you want to talk about those? Because people think that we dropped them, but we actually didn't drop them.
Right. I think that's an important point. One of the things we have heard most is, did you get rid of Hitchcock? And in fact, we did not get rid of Hitchcock. We're still using it as the Dartmouth Hitchcock Medical Center and the Dartmouth Hitchcock clinics for all of our various outpatient locations. And I think understanding it is, there's a brand architecture that we've employed, which was to create a system brand, the Dartmouth Health brand. But I think we have a slide up which shows you how we are expressing, it's kind of in brand language, we call it a signpost, how we've signposted each one of our members. And then for the Dartmouth Cancer Center, which the Norris Cotton Cancer Center has been renamed, but we found a way to honor Norris Cotton. We're renaming our patient pavilion here in Lebanon, so we have the Norris Cotton Cancer Care Pavilion. But we really wanted to find a way to emphasize our strong relationship with Dartmouth College and Geisel School of Medicine, because the Cancer Center has that shared organizational structure to it, and we really wanted to find a way to talk about the research and all of the discovery science that goes on there, and then is delivered in clinical care. So we found a way to do both honor Norris Cotton and draw that parallel to the college. And then for the children's, we haven't gotten rid of Chad. The Children's Hospital at Dartmouth Hitchcock Medical Center still exists. what we did is we created a kind of a breadth, an identity that would encapsulate the breadth of pediatric services throughout the entire system. So Dartmouth Health Children's, and it was the one exception we made to playing with the visual identity, because we really wanted to make sure that they had a unique way to represent themselves. So you'll see there's a different color thread for the Dartmouth Health Children's, and a little bit brighter and brighter palette than they've had in the past. We wanted to also appeal to teenagers and adolescents with a kind of more dynamic, modern palette.
Yeah. Well, you guys did that very effectively. So, and I know that as Sue Mooney articulated in the video that we put out on YouTube, for some people that feel that we're so attached to certain names or certain nomenclature, there is kind of a sense that something that they loved was going away. But number one, not really going away, and number two, being replaced with something that actually was much more reflective where we're going,
Right.
and then instead of where we were. So, now, your efforts to rebrand Dartmouth Health is much more than the logo that people are seeing. And I think people do actually believe that kind of branding is just marketing, but it's actually not just marketing. There's a lot behind it. So talk a little bit about that.
Sure. Yeah, it's about the essence of the organization and the culture, and brand touches so many different things. And you're right, everyone thinks of it as a logo, Nike or Starbucks. It's not just a logo. It's about the people and who the heart of the organization is, and how we talk about ourselves. And it touches advertising, it touches fundraising, it touches employees. Think about our prospective employees, and one of our, as the kind of largest healthcare, the only healthcare system in New Hampshire and the largest employer, it was also important to us to really build a story that we could tell around who we are as an organization, and all of what we can offer to prospective employees and also our current employees. We really recognized how important that would be. And then we thought a lot about patients and that clarity piece that I spoke to, and it's about the essence of the heart of who the organization is. And I think when we think about change, as you mentioned, and I know change is hard, and we knew it would be hard, and we really recognize that it is hard, but also at the heart of it all, the patient care isn't changing, the quality isn't changing. We just wanted to be able to share it in a way that our patients would understand, and our community and our employees.
Yeah. People don't realize that our brand really, or just the appearance of it, has not changed since 2009.
Good.
And then I think before then it was in the 70s or
1989.
1989. So it's not like we're precipitous, or this is the flavor of the
Right.
year. And there was just incredible thought going into it. And
Yeah.
I think everybody in the room appreciated that when we did our launch on Tuesday. So
Yeah.
kudos to you and your team. I know that there were a lot of sleepless nights, a lot of long weekends, and a lot of
Yeah.
extra hours put in by your team in order to pull this off, but you guys did a great job.
Thank you.
Now, I want to remind our audience that if you have questions, please comment in the chat function, and it will miraculously turn up on my iPad, and then we can answer your questions. We want to make this interactive with our audience. Now I'd like to turn to my next guest, who partnered closely with Jen on this journey, Brad Scott from Applied.
Hello.
Hey Brad, how are you?
I'm doing great. How are you today?
Great, thanks for joining us. So
Good. Thanks for asking me to join.
can you share a little bit about what your company does and your role in this effort?
And so Applied Design, we're a marketing communications company. We specialize in design and branding. And we work primarily with mission-driven organizations like yourself to really help solidify the ideas that you bring to market so that you can build a powerful brand and a powerful communications tool to help achieve that mission. And that's really what our goal is clarity to be able to help you and our clients get what they need to get, whether it be great patient care or whether it be courting donors or whether it be some other business objective, helping to really kind of crystallize the way you go to market to be able to accomplish those goals.
Hey, I have an off-script question. So,
Mm-hmm.
how do you do that during a pandemic? Were you able to actually come up and visit with us, or how did you kind of get an understanding of who we were? Because you guys did a great job. I mean, you captured it.
Oh, thank you. Yeah, we were very lucky in the timing. We were able to come and visit you just ahead of the pandemic. So it was basically in the fall of 2019 and then heading into early 2020. And then, honestly, we all had to work together to figure out how we were going to do the next step. And it was a lot of Zoom, it was a lot of video conferencing. But what most importantly happened was it was a lot of conversation. And I think probably more than we would have done normally, because a lot of the barriers of travel were eliminated, right? So we were able to very quickly get on calls with the people inside of your organization, with Jen's team, with you, with your direct reports, with people at each one of the members. And I think being able to do that really allowed us to make micro adjustments to what we were recommending. And I think you kind of talked about this a little bit. It was each time we were interacting with different people inside of the organization or people outside the organization, it really helped us to kind of make a fine kind of adjustment to what it was that ultimately the visual identity was going to be, but more importantly, how you were going to be presenting yourself as a brand. Mm-hmm. So even though it was challenging at first, and I remember being in many meetings with all of you where we were trying to get our internet to work and we're trying to get the cameras to work and headphones and everything else, I think ultimately what it did do is it allowed us to get even closer to the organization because we got to spend more time with all of you.
Mm-hmm. Now, there are a lot of people that would say, why would you change your name and your visual identity? Why do companies go through rebranding? Obviously, a lot are, because mm-hmm. we received a number of calls immediately after our launch that other health systems wanted to learn from us. But why would an organization do this?
I think the simplest answer is clarity, and it's about being able to help the people who need you the most understand who you are. And in a lot of cases, it might just be little side steps. I mean, even though it was a rename, it wasn't a big rename. With Dartmouth Health is not that far off of Dartmouth Hitchcock Health. So it was about just eliminating just one more, impediment or barrier to your patient. And in a lot of cases, it's also people embark on these journeys because they want to reflect where they've arrived, right? So you want to honor where you've been. You want to reflect where you are today, which is usually 9 times out of 10 very differently to where you were 5 years ago. And you want to build a foundation for the next 10, 15, 20 years as the organization progresses. Those are really the 2 major reasons. It's clarity and reflection and progression of who you are and what your mission is.
Now, I know that your team really spent a lot of time on the kind of the visual change for our logo, which is mm-hmm. probably one of the biggest changes. We had a very sharp, I think, radiology tech who immediately emailed me and said, and talked about the difference in fonts in Dartmouth Health. So I want you to kind of talk mm-hmm. about your thinking behind that. And for those of you that might not have observed it, you look at the H in Dartmouth and it has little feet, and you look at the H in mm-hmm. health and it doesn't. And
yes.
But talk about kind of the process of kind of coming up with a logo. I know that you probably mm-hmm. you presented it to the executive team, and we know nothing about marketing, so there were a lot of blank stares there. But you navigated really trying to get feedback from us in a very skillful way. So number one, kind of talk about coming up with the logo, and number two, talk about the fonts. That was very purposeful.
Yeah, it was very purposeful. I didn't realize that was a radiology tech
Oh, she's
who did
very
that.
sharp. I was very impressed.
Those radiology people always get us, because they're, that's their business, right? Is looking at those nuances. So it's kind of funny that's who noticed it. I'm going to start there because I think it brings up a really interesting point. Whenever you start with an identity, you want people to you want it to be the start of a conversation, right? And when it launches, the question is, well, why did you do it? And the why becomes a really important part of the initial launch. And, people are like, okay, I understand this is about progressing who we are. It's about achieving these goals, things like that. But it really starts a conversation. And as things go on, what you'll start to notice about the identity is that other things start to reveal itself. So more of the story and how it reflects to where you want to be with your mission. So the thing that was amazing about that person picking up that font is that it's actually the same font. It's two different versions. The top version is the serifed version, and that's the little foot that you're talking about. And the bottom is actually what's called a sans serifed version of it, so where it says health. And that's why if you specifically look at the H in the top line in the Dartmouth, and then you look at the lowercase h in the health, they look different, but they're actually the same family. And that was one of these little, we call them Easter eggs. It was a little Easter egg of nodding to kind of who you are now and where you've been, and a nod to your history. That's the serifed font, which is considered a more traditional font. And the sans serif font is a nod to where you're going, which is more of a future font. It's more of a high-tech font that recognizes kind of the level and the research components of what you do. So those two things together help to tell the complete story of the organization. Now, to answer your question about how do we come up with these things, it is based on strategy. And in this particular case, what we were trying to do was talk about world-class care woven into the fabric of the community. And that can be articulated in so many different ways. But the most telegraphic way to do that is to literally start looking at something like weaving, right? Weaving transcends all cultures. It's completely inclusive. In a lot of cases, it's a community endeavor that people engage in. It can be as simple as just a basket weave, or it can be as complicated as the looms that we see, in kind of mass production today. So it kind of goes back and forth between the two. And we wanted to use that idea of woven into the fabric of the community to start to literally express it in the logo itself. But at the same time, we wanted to make sure that we were clear. So we couldn't be overly indulgent in or overly literal in how that was interpreted, but it had to be actually very crisp and clear so that it could perform in the world that we live today, which is digital media, right? It had to look good on screen. It had to look good small. It had to be able to be redeveloped from a print perspective. So it was, those are just a few of the minor things, but I think the takeaway from there is it starts with who you are and the strategy that we're working from, and then we articulate that into the visual design.
Yeah, it's interesting that I remember the early conversations about the logo, and that it felt like inside it was embedded in a cross that you see in Europe that designates pharmacy, and that actually spoke to us about healthcare. But people look at the logo and they interpret it a little bit differently according to the worldview. I had somebody that said, oh, the weave was really great because you're weaving in your collaboration with Geisel and the college into the weave. And I thought, that's actually a really interesting insight, because it's true, they're our incredibly important partnership, but that was what they brought to interpreting the logo for themselves. So you see a lot of this.
And that's a really important part of what we do, is we want people to be able to see themselves in that. Because that's ultimately that's ultimately what the brand is, right? Everybody looks at the logo as being the brand. The brand's just one component. It's a visual articulation of who you all are. So it becomes really important that it bring together all those pieces. The other part that I always liked about the weave was the strength, right? It's the strength that comes together from intertwining fibers that makes it exponentially stronger together than it would be standing on its own.
Yeah.
So, that's my interpretation of it. That's why I was always excited about it. But other people have other ways of looking at that and seeing themselves in it and seeing how that can be a unifying idea for helping to drive the mission of the organization forward.
And I think when I translate that to some of our other components, we have a lot of, we call it swag, but gifts for employees to demonstrate the new logo. That one of them is a tartan, isn't it? A tartan kind of cloth with a scarf.
Well, we're going to be. We haven't developed it yet, but we are going to be rolling out a tartan, and we're super excited about that because of the kind of, there's a tie too to this area with the Highland Games, which are the North American kind of capital is in New Hampshire of the Highland Games, and there was like that tartan weave, but it also has the textile history here in this region too.
That's pretty incredible.
Yeah.
The taping at the Milliard Museum, you guys did an incredible job taking that site and actually showing its relevance to our new brand. It was masterfully done. It was really great.
It was fun.
I've got a McCusick, and my late husband was a Bruce from Scotland, so we've got a lot of tartans in our family. So we've got some questions from a lot of our viewers. So the first one for Jen, how were you able to allocate funds for this large of a project?
Well, we some of the funds come from our normal operating budget that we have for communications and marketing, and then this is a sensible but meaningful investment that we're looking at it over a few years. So we were really mindful around the landscape and thinking about it in a long-term kind of way, going back to that transition, not a light switch.
Yeah.
Yep.
And a lot of the work that went into the brand is a little bit more strategic planning than really communications and marketing.
Yep.
So there's a lot of kind of synergy between everything else that we're doing in the organization. I've got a question from an employee at Cheshire. How does the new rebrand impact me as an employee?
Well, I would say the great thing about having a system brand is it brings us closer together. So as an employee, it reminds you of all of your colleagues throughout the entire organization, right? Because you've got Dartmouth Health, and we're all part of Dartmouth Health. So while it allows you to have your unique nuance and your unique community and retain the name Cheshire Medical Center, at the same time, it is a way to help you articulate who we are and the kind of care we deliver. Hopefully it's providing more clarity and language for you as an employee to understand what we're all about as a system.
The next question is about removing the Hitchcock name in the health system, even though we haven't removed it from the Dartmouth Hitchcock clinics or Dartmouth Hitchcock Medical Center, which will retain the Hitchcock part of the name. And the question is, does it mean the college is more involved now? The college is a very important partner. The Geisel School of Medicine, which is in the college, is our academic and our basic science research partner. We are two of the largest employers in the Upper Valley. We are the largest private employer in the state. And it is just critical for us to work together. And over the last 5 years, we have found so many opportunities for us to work together. And I think it's benefited not only our organizations, but the community as a whole. And it runs the gamut between focusing on research, focusing on housing, focusing on transportation, supporting each other in many ways that are just incredibly beneficial. So do you want to add anything to that, Jen?
Yeah, I'd say also just from a purely practical standpoint, we talked about the collaboration through the pandemic with our members. This brand journey was also a great collaboration for me with my colleagues at the communications and marketing at the college, and it really brought us closer together too, and really thinking about exciting ways that we could, work together in the future too. So it's all about collaboration.
Yeah. I like to say that sometimes we solve world problems in aisle 3 of the co-op here in the Upper Valley, and that's collaboration between Dartmouth Health, Dartmouth College, and the Geisel School of Medicine. And we're actually a pretty small community, but our impact can be tremendous if we work together. So I want to thank both of our guests, Jen and Brad, for joining me today, and I hope all of you are as excited as we are for the future of Dartmouth Health. Be sure to check out our new website, dartmouthhealth.org, and have a wonderful day. Enjoy the sunshine. Thank you.